I'm here to talk to you and to introduce someone that is really spectacular. Has an incredible career, and she has been saving and protecting all of us in Illinois without you even knowing. So every time you went to bed, someone was talking about, well, maybe they'll need a countermeasure in preparedness. So she has been working around the clock for years to protect you. Dr. Carla Little, Ph.D., and she has a Ph.D. in laboratory sciences. She from the prestigious Purdue University, and her PhD was in molecular biology. Most people don't even know how to pronounce that, never mind know what it means and what to do with it. She actually was a chair of the ASTHO, the Association of State and Territorial Health Officials, Countermeasures Committee. She was the inaugural chair and actually served in 2 terms in that position. She also was in the Illinois Department of Public Health Office of Preparedness and Response, where she was the person who was looking at the stockpiles for countermeasures and also for preparedness initiatives to make sure that things were done in the right way. She was also part of the H1N1 response back in 2009, and I had the honor and the privilege of serving with her at that point as the director of the department. But she was really essential for everything to work. She helped to make sure things were going well, and luckily we had her, and we were able to push through with very little problems, and actually had a really good outcome for Illinois. She also is the president of her local school board chocolate chips program. She's actually training young ladies who are in STEM, because women are often left off of the platform for sciences and engineering, technology, mathematics. So she actually has been pushing these girls who are in the grades of K through 12. She was the president of her local school board. You want to have a nice job, be a president of a school board. Anyway, she's also a member of Delta Sigma Theta, proud member, Incorporated, and she was the social action chair of that group as well. So welcome, 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 Carla. How are you doing?
Hey, great. Thank you, Dr. Arnold. Great introduction.
Oh, okay. Well, I really wanted you to be on this because of the public health issue that I'm bringing up. So, about 6 months ago, I started an organization. It was the African Diaspora Association of Public Health Professionals. And the reason why I thought this was so important was because we needed to make sure we were having people who were being trained across the diaspora, from Africa to Central America to South America to here in the United States. And when I say diaspora, all of us had some origin in Africa, but people of color have been excluded many times from participation in the STEM categories, preparedness and response. And we really need to change that, because in order for our entire nation to survive, we need all people here to be part of this process. We've been hit by all kinds of global warming effects with hurricanes and floods. I responded to Hurricane Katrina and Rita back in the day. We had General Honore, who was on the last show. He's of the Katrina fame, the 3-star general. So we need to have people who are part of the community becoming more adept at taking care of everyone. Everyone's life matters. And in order to do that, we need to have the total participation of the community. So the motto of this organization is perfect African diaspora health and wellness through unity, leadership, and education, so that all may be affected positively. The vision is a network of public health professionals that ensures African diaspora health and wellness. And the mission is to advocate and unify public health professionals regarding STEAM education, AI usage, employment, and healthcare support systems ownership throughout the global landscape of everyone who is here on this earth. So that's really where we're trying to move. Some of the objectives are to facilitate African diaspora public health professional scholarship and employment, thereby assuring tangible impacts to strengthen community identity, resiliency, health, and wellness. And I know you have been instrumental in pushing the STEAM program and making sure that people understand the importance of becoming part of the technological revolution. And so, give me an idea of what you have been dealing with. You've been dealing with veterans, you've been dealing with community members in your response efforts across our state and actually nationally, from the positions you've held. So tell me, what is it like to be someone in your position who has that kind of knowledge, who is a molecular biologist and understands the human element too, the grassroots needs? And mute. Mhm.
I am unmuted now.
Okay.
Yeah, first of all, I think um, with my background and experience as a PhD scientist in molecular biology with a concentration in virology, I started off in the state lab,
Mhm.
originally with the CDC, and then moved to the state laboratory. But wanted to have the position in preparedness and response for that reason, to help educate and inform the community on public health emergencies, so that we can educate and train people early in the response. One of the adages for any emergency is all emergencies are local, and that we would expect to take care of ourselves for the first 72 hours prior to any type of government assistance, right?
Yes.
So it's important then that we educate our communities and prepare our communities on that notion, to understand what do we need to do for for our own personal protection when it comes to public health emergencies, whether it's a biological event, a flood, or things, nuclear, rad nuclear, right? Chemical, we
Yes.
deal with all types of events that we plan for. So that was really what led me to get involved in the Office of Preparedness and Response, just so that I can help. I'm an educator by just at heart. So it's helping to prepare and advocate and train the community. So one of the programs that I've been involved with too at the state level, not just writing the plans for preparedness, medical countermeasures preparedness, I wrote the mass vaccination plan for the pandemic response, the most recent one, but also working with organizations, community level, at the state level, to make sure that their members are also aware and trained. And then working with our volunteer management coordinator to ensure that groups are formed to help, medical reserve corps community groups, for instance, to help be trained and prepare for any type of emergency.
Yeah, because you got involved with EMAX too, right? With you know, different states that surround us, and so
Yeah, I I work with other states in the area, but EMAC is more of a emergency management
Mhm.
um, tool. So it's handled by the Illinois Emergency Management Agency for the state. But I coordinate across state boundaries in planning.
And planning, right? Yes, yes,
Hmm.
yeah. And then, so what do you think that we need to do? Because right now, there's one thing that happened that was really, a great thing I thought happened, and it was talking about the need to have people, African Americans, and especially veterans and people who are coming back who put their life on the line to have opportunity for education and a job. But Michael Bloomberg just released $600 million for four historically black medical schools.
Wow.
And he gave 175 million to Howard University in Washington, D.C., 175 million to Meharry Medical School in Nashville, Tennessee, 175 million to Morehouse in Atlanta, Georgia, 75 million to Charles R. Drew, uh, medical sciences complex there in Louisiana. Oh, I'm sorry, in L.A., California. So it amounted to about $600 million. But he also gave an additional 5 million to help start a new medical school at Xavier University of New Orleans, Louisiana. I really want to applaud him for this. He was a
Yes.
former mayor of New York City, and just to do something like this means so much. it almost doubled the amount of money some of these schools had in order to operate in endowment funds. And this is the kind of person we need that is going to really care about the community and make sure things are going on. We lost almost over 360 African American hospitals in the last 30 years. We're down to zero right now. So these are some of the things that we're confronting, and we need to be getting into the medical field, not being excluded from it. So, we have these different issues about DEI and all those things going on, but I really feel like there's a need to sort of propel people and to put it on the platform that people need to get trained and to get the opportunity to go forward in STEAM. So, what are some of the things you think we could be doing, in the governmental level, on the local level? What should we be doing?
Yeah, I agree. I really applaud Mayor Bloomberg for the work that he's doing at the medical school level. I think in terms of what we
Mhm.
can do at the local level, one of one of the things that veterans can take advantage of is the preference in hiring at the local level and at the state and federal level. I know, and you know this too, Dr. Arnold, from your experience in working in state government, that we need veterans in state government, especially in public health and public health preparedness and response and emergency management overall. There's not a lot of people in emergency management that look like us.
Mhm.
When you go into those rooms, it's predominantly a white space, right? So it would be great if we could, um, create some awareness of this field of public health, emergency preparedness and response, and medical preparedness and response, as well as just emergency management in general. It's
Mhm.
a growing field. It's one of those fields that took off after the anthrax attacks of 2001. So not a lot of people know about it. But you can, and it's one of those fields too, where you can almost if you come in with the right credentials, you can get on the job training because again, it's a new field and not a lot of, it's just starting to be college programs and certifications that you can take to enter the field. So a lot of it is on the job training. So I
Mhm.
would just highly encourage veterans to get involved because you've already been trained, right, through your service in order to respond and to think critically, about how to plans, how to respond to plans and things like that. So you just come in and get the training, and it's really needed.
Yeah, and a lot of the veteran communities, we have veterans who are, working in poor circumstances. Some are in poverty, some are homeless, and y- you know, just to give them the opportunity to become part of that network is so critically important, especially now. We're seeing more tornadoes than we've ever seen before, hurricanes with the intensities that we've never seen before. They're affecting all of our communities. And as a molecular biologist, I know you'll like this reference to a litmus test, but we have many of them around, right? So many of the litmus tests are, the inappropriate care that African American women are receiving in the healthcare system, people not getting proper treatment for diabetes and hypertension, and getting the access to care that they need in our communities to make sure that they are doing well in our Latino communities, American Indian communities, and in our poor white communities. The access is just not there. And
Hmm.
I'm really looking at that, and the other litmus test that we've had is the COVID and the disparate impact that it had. So if COVID has a disparate impact, and we see the reports that are coming in about which communities actually fared the worst, and those were mostly communities of color. The question
Hmm.
is, are we at a point where we're waiting for a disaster to happen, a tornado, a hurricane, a fire, a forest fire, before we start to act? Many of the things that we had down in with Hurricane Katrina were reactionary, where we had people crossing borders from states, and I'm not sure of how they've resettled or what state of affairs they're in now, even. Many of them that lost their jobs, they lost their pets, they lost everything that they worked for. So we need to have more people of those communities that look like the people there that can talk to them and prepare them, and have preparedness as a real issue, not as a reactionary issue.
Hmm. I
Yeah.
agree. I think, it empowers people to have the knowledge and to know beforehand what what plans are in place at the local level, because every local
Hmm.
government has a plan to respond to all of those disasters, right? Every
Right.
state government has a plan. The federal government has a plan, but a lot of times people are not aware of the plans. So it's empowering them with that information up front, knowing who to call during an emergency, if they do have questions, understanding, their personal responsibilities, in an emergency too. That helps, sort of allay some fears that happen. So, Katrina is a prime example of some of the problems that occurred because not enough people were aware of what were the resources that were available, how to request the resources that were available. So there was
Right.
a lot of panic. And even in the case when at the beginning of the pandemic with the COVID response, there was such a lot of misinformation. And because the government was slow to respond, and I'm speaking, as a private citizen too, in my opinion here. But our government was so slow to respond that people panicked, and that created probably more infections and more deaths, and because of all that misinformation due to that slow response. So if we can
Yeah.
empower people ahead of an event, especially on those biological things, because people are somewhat afraid. They
Yes.
afraid of anything that's biological that they can't see.
Right.
Um,
Sure. All
so
the
just
zombie apocalypse movies help with that one, right?
right. So that's just
Yeah.
our job is to empower people before the event so that they don't have to panic.
Right, right. Yes. And there are ways to protect yourself, that people need to know about. I mean, even simple protections like wearing a seatbelt in your car, you know,
Yes.
not driving through water that's deep. So during a storm, you know, so this, common sense things that we should be having at our fingertips so that people don't do those things. A lot of people were swept away by water in their cars because they didn't realize, how serious it could get.
Yeah.
But just that educational piece and having community engagement, with people for that. But one of the things I always marvel at is that we know what the solution is, right? More education, making sure we have the regular, hiring practices. So it's really education and having equitable hiring practices so we can get people in and support systems once they
Hmm.
get into their positions to thrive in the environment. And I know you were in your position for more than 20 years, and you're not representing, IDPH or anyone else right
Right.
now. But that is something that I think we need to be keenly aware of. Our legislators need to know that as well, that they,
Hmm.
as part of their responsibility for, looking at their constituents to make sure that that is implemented and it's here and it's real and tangible, and not just to throw our schools away. We have many schools that are underperforming because they don't have enough funds, they don't have enough teachers, they don't have enough. This is a cancer that's in our country that we have got to get rid of. We've got to
Yeah.
cure this.
And that's one of my public service is a passion of mine, as you know, and
Mhm.
education, public education, public health, those are areas that I invest a lot of my time into, because I do feel that, in terms of public schools, the whole idea of a public school, right, originally was to educate the masses so that they could, vote and secure our democracy, right? That's
Yes.
really one of the primary premises of public education. So, in order to keep that strong, like you said, we have to invest it, and we have to, whether you're a parent or someone that lives in the community or a business owner, you really should be investing in public schools and holding public schools accountable, for the service they're providing to the students, but also what they should be providing to our communities. And that is not done all the time. And I think that's a part of why public schools languish, because, of that lack of oversight, the lack of eyes on it, and people thinking, well, I don't have a kid in the school, so I don't have to get involved, or I didn't finish high school, so I don't know, I don't want to talk to teachers, things like that. It's somewhat intimidating. But, public schools, again, like public health, is a place for everybody to engage. And I know from, my service as a school board member, that's one of the things we try to do is to engage the community. We know that 70% of your taxpayers don't have kids in the school, right?
Yes.
And that's typical for most communities. So, so you want to get those people involved. You want them to be a part of the school. But all of that, again, helps to not only help the school, right? And help the kids learn, because they when people are engaged, they learn better, but it empowers the community to have control of that resource and understand that that's a resource that belongs to them. And it just helps overall.
Yes.
So
Yeah, and I'm getting to the point where we'll be launching a website and a StreamYard line on the ADAPHP, but the African Diaspora Association of Public Health Professionals, and I'm hoping to unify people from Africa, South America, Central America, and the United States. We already have about 89 members, and it just started about 6-7 months ago, and I think that this is really an essential thing. And the reason is that we have to dispel misinformation regarding the African diaspora's historical contributions to science, public health, and medicine. And I remember giving a talk. I received a community service award from the CDC at one point, and they said, "Well, we want you to give a talk." And I said, "Well, what do you want me to talk about?" And it was like, "Well, equity." And I was like, "Okay, that's the only thing I can talk about." Okay, so equity. I said, so we had about 300 people who were in the room, and I said, I asked them a question, and I said, "What do you know about Albert Einstein?" And they looked at me and they were saying Albert Einstein, and they were like, "Well, equals MC square." Albert Einstein was a genius. He Manhattan Project with the atomic bomb. He escaped from Nazi Germany. His wife's name was Elsa. He taught at Princeton University. I said, "Anything else you know?" And they said, "He was the greatest scientist ever." And I said, "Okay, Albert Einstein was the co-chair of the anti-lynching movement with Paul Robeson. He had dinner with him 3-4 times a month. They were very good friends. He never taught at Princeton University. He was a bench scientist. He never taught an undergraduate or graduate student. But in his free time, he went to an inner city elementary school. It was all African American. He said, and the press and media approached him and said, "What are you doing wasting your time with these children?" He said, "One of the greatest sins in this country is the wasting of the skills, abilities, talents, and absolute genius I see in these children." He used to sit on on doorsteps with people. He in the community, and he used to love jazz and go to jazz clubs. He stopped W.E. Du Bois from being falsely imprisoned. This is someone that was a social activist, but you never heard that. And I said, so all of you have been, this is one of your central figures in your scientific education. You didn't know this. I said, before we can talk about equity, I'll come back and talk about it, but you have to re-educate yourself because you've been miseducated about this. And that's why you select the people you do in your committees, why you select the people who you're going to be mentors to. We have to change our perspective of who we are as American citizens. And I think the military has been pushing for that for a very long time. But I'm going to have you back on the show. Of course, now that you've come in, you're going to be trapped onto this show for the rest of your life. But we're going to
I
have
love it.
multiple different shows on different various topics. And just thank you for taking your time. Carla Little, who is a Ph.D. in molecular biology, one of the greatest scientists I've ever seen in my lifetime. And she is influencing other people to follow the same track. And she's kept you safe while you were sleeping at home, just like we kept you safe being warriors overseas in Iraq and Afghanistan. she was here helping you every day and you didn't even know.